Facial nerve decompression. We have seen earlier an extended posterior tympanotomy and the completion of a modified radical mastodectomy. Still, a part of the anterior buttress is left, which will be cleared subsequently. Now, drilling is carried on over the second genu of the facial nerve, which lies lateral to the pyramidal process. Be careful not to drill the lateral semicircular canal, which lies superiorly. The thin segment of bone over the fallopian canal, over the second genu, and the horizontal part is drilled. You can clearly notice the dome of the lateral semicircular canal. You can clearly identify the processus cochleariformis. So now the bone over the medial aspect of the fallopian canal is being drilled. The bone of the processus pyramidalis is drilled to expose the stapedius muscle. This is small diamond burr. Be very gentle while drilling over the facial nerve. The medial part of the fallopian canal in the lower segment is being drilled to expose the sinus tympani. Still more smaller diamond drill is used now. Drilling is proceeded towards the processus cochleariformis, and that is the horizontal segment of the facial nerve. A small spicular bone over the stapedius muscle. You can beautifully visualize the stapes head and the two crura along with the foot plate. Be as gentle as possible. Take your own time. Be relaxed, cool while working on the facial nerve. Constant irrigation is a must in live patients. This is a cadaver dissection of the left temporal bone. Above is anterior, below is posterior, on the right is superior, and the left is inferior. Be very careful at that point. That is the place where you get the ampullary end of the superior semicircular canal. Gently palpate over the facial nerve whether any spicules of bone is left. In this case, I will not be incising the sheath of the facial nerve because that will make the further dissection difficult, and the nerves will be entangled in a drill. while exposing the labyrinth, the nerve may be trapped in the orbit. So I will not be inside the sheet right now. So the drilling is continued inferiorly to spot out the lower part of the vertical part of the facial nerve and its relation towards the anterior part of the digastric ridge. Once you can locate the anterior end of the digastric ridge and the lower segment of the facial nerve, drilling becomes easy because the path of the facial nerve is very clear now. Work along the fibers of the facial nerve, along the root of the facial nerve. Try to avoid working perpendicular to it. Once you know the course of the nerve, you can follow it easily. I'm using a diamond burr once I am close to the facial nerve. You can see how beautifully the facial nerve is being traced. These are the small hair cells, the retrofacial hair cells, lying anterior to the digastric. There is the bone adjoining the floor of the external auditory canal. See how cellular is this mastoid. This is again an unedited video for beginners. so it will be slow. Now we can beautifully see the digastric ridge along with its muscle. How beautifully the anterior end correlates with the vertical part of the facial nerve. If you watch this video from the beginning of cortical mastectomy, you will be able to understand it better. And now the lower half of the vertical part of the facial nerve has been well delineated. There are a few group of hair cells which are placed anterior to the facial nerve. So you can see beautifully the vertical part, the second genu, horizontal part of the facial nerve. Again, I will not be pulling out the facial nerve from the rest of its canal, because when we do the labyrinthine work, the nerve might get entangled. Horizontal part of the facial nerve, second genu, and the vertical part. Now this is a beautiful endoscopic view to see the anterior or the digastric linking with the vertical part of the facial nerve, and then the second genu, the horizontal part up to the process cochleariformis. You can see the chorda tympani, the stapedius muscle, the stapedial tendon, the stapes head, the anterior and posterior crura, the footplate of stapes, and you can see the cochleostomy hole. You can see the rest of the promontory, the hypotympanum, the Eustachian tube orifice. Everything can be seen. See how beautiful it is. Process cochleariformis, the stapedia, and the tensor tympanic tendon. This is a close view of the nerve sheath. Close view of the processes cochleariformis and the tensor tympanic tendon, which is getting attached to the neck of the malleus. This is the vertical view. We are seeing the vertical part of the facial nerve, second genu, horizontal part, again the stapedius tendon, the stapedius muscle. You can see the ponticulus, you can see the stapes head, attic space. That's how an endoscope gives an excellent view of the middle ear structures. Anterior and posterior crura, tensor tympani tendon, and the muscle, that is the epitympanic diaphragm, anterior epitympanic space, almost everything is very clear, but the bone is irregular over the labyrinth. That will be corrected while doing carving the labyrinth. Okay, thanks for watching.